Imagine a day when your usual cough feels a little different, maybe more persistent, leaving you wondering if it is just a common cold or something more significant for your chronic obstructive pulmonary disease. Yes, a noticeable increase in coughing can indeed be an important early sign of a chronic obstructive pulmonary disease flare-up, also known as an exacerbation. It is your body's way of telling you that your airways are more irritated or producing more mucus than usual, indicating a worsening of your lung condition. This is not just any cough. A chronic obstructive pulmonary disease flare-up cough often comes with specific changes. You might notice your cough becoming more frequent, feeling deeper in your chest, or producing more mucus. Pay close attention to the color and consistency of this mucus as well. Changes to yellow, green, or even brownish hues can signal an infection, which is a common trigger for flare-ups. The why here is that your airways are reacting to increased inflammation, irritation, or infection, leading to that heightened cough reflex to try and clear the lungs. To determine if your increased coughing is indeed a flare-up, start by monitoring its characteristics carefully. Keep a simple journal, noting when the coughing spells occur, their intensity, and any changes in mucus. Also, listen for other accompanying symptoms like increased shortness of breath, wheezing, or chest tightness. These symptoms often appear together during an exacerbation. It is also helpful to consider if you have been exposed to any known triggers such as smoke, pollution, or recent infections. If you notice a sustained change over 1 or 2 days, particularly if other symptoms are also worsening, it is time to act. Understanding your personal baseline for coughing is a powerful tool. What is normal for you? Even a small deviation from your usual pattern can be a significant indicator. Doctors often refer to this as a change from your usual symptom variability. Also, remember the 3 cardinal symptoms of a chronic obstructive pulmonary disease exacerbation: increased shortness of breath, increased sputum production, and increased sputum purulence, meaning the mucus becomes thicker or discolored. An increase in coughing often precedes or accompanies these changes. By carefully observing your cough's frequency and characteristics, and coupling this with awareness of your other chronic obstructive pulmonary disease symptoms and personal baseline, you empower yourself to recognize potential flare-ups early. Early recognition means you can consult your healthcare provider sooner, allowing for timely intervention and potentially preventing a more severe worsening of your condition. This proactive approach is key to better managing your chronic obstructive pulmonary disease and maintaining your quality of life.